I'm Lucy Beadnell with the Arc of Northern Virginia. It's now March 11th of 2024, and we have some news from our state General Assembly that concluded just a few days ago. We'll give some caveats along with that news too, of course, but we want to give you an update at this point in time. First, by thanking everyone who engaged in the myriad of ways we advocated this year, by telling your story, joining us on the bus to Richmond, sending legislators responses to action alerts, and telling your story. All of the good things that came out of this session were the result of your efforts, and we're so grateful. Keep in mind that anything that comes out of the General Assembly can be signed by the governor within 30 days, which means it will go into effect. It can be amended, or a change would be offered, or it can be vetoed. So we will now see over the next month how the governor reacts to the legislation and the budget presented by the General Assembly. The General Assembly is scheduled to go back into session on April 17th to act on any vetoes or amendments. So we're hopeful that the things that we're sharing with you today as a point in time update continue to be true after April, and we'll keep you posted on that as well. Let's look at some of the things we were advocating for this year. First, Virginia has a waiting list of more than 16,000 people waiting for a program called the DD, or Developmental Disability Medicaid Waiver, that provides caregivers and other kinds of support so that people with disabilities can live a full, included life in their community. The governor put in a plan to make sure anyone who is currently on that list and in crisis would get services within the next 2 years, and the House and Senate have left that money in the budget, which is great news. The House and Senate adjusted the rules on this plan slightly to say that instead of those waivers coming out in two large chunks at the start of July 2024 and July 2025, they'll go out in smaller chunks each quarter to give our system time to work with families as they're coming into it, and for our provider community to build capacity. Also, if someone with a waiver is having a lot of trouble getting services started, maybe they're incarcerated or in a physical rehab facility following hospitalization, there'll be a greater extension for the time that they have to get that waiver up and using before they risk losing it. Unfortunately, our hope that core services, some basic care to the rest of the waiting list, would be studied didn't happen this year. We'll go back and look at that again next year. We did a lot of work to make sure that provider capacity was increased, mostly by increasing reimbursement rates. Our hope that supported living, a residential service that's smaller and more customized, would be matched to group home rates didn't happen this year, but that doesn't mean we'll give up the fight. There is a 3% increase for providers for most waiver services. There's also an increase in peer mentoring, that service where someone with a waiver mentors someone who is receiving a waiver or is looking for a waiver. We're happy to share that if you have a one-to-one caregiver billing for what's usually called personal or attendant care or companion or respite care, that those caregivers will get a 1.2% increase in January of 2025 and an 11.1% increase in January of 2026. Again, assuming that the governor signs the budget as is on these areas. If you use consumer-directed services to bring waiver caregivers into your home, your service facilitators will be getting a rate increase, and the requirement that they have certain four-year degrees will be removed. There's also some great news for people who use waiver and are at risk of their job or their parent's death, making them ineligible for waiver. First, a bill from Senator Favola will have a study due out in November that looks at whether or not we could improve our current Medicaid Works program in Virginia. That program allows people to earn up to $75,000 a year and continue to buy in or pay into Medicaid to keep that service if they need it. But right now, DD waiver users aren't allowed to take advantage of that program. We hope to see news out of that in November and possible action on that in the 2025 General Assembly session. There's also a bill from Delegate Chen and Senator Eben that looks at making sure if someone with a disability moves from that base level $943 a month this year in SSI income to the higher SSDI income, because a parent retires or passes away, or the person with a disability has a long part-time work history themselves, that move from the lower benefit amount to the higher benefit amount doesn't prevent them from working or keeping their waiver. And that bill works by saying, even if you move to that higher benefit amount, when we're looking at calculating your waiver eligibility, we'll only count that lower SSI amount where you began to remove that penalty. This bill is going to go into effect for 2 years for a chance for us to use it and study it, and we hope to go back in 2026 with great data and make it permanent. I am so pleased to share that thanks to efforts from Delegate Elizabeth Bennett Parker and Senator Marsden, after years of effort, people with disabilities and their parent caregivers, family caregivers, and guardians, if they need to participate virtually in a volunteer advisory board or commission, that they can do that. We know that that's a hugely important accommodation for the disability community. And though that was allowed in the past, people participating virtually didn't count towards the quorum. And sometimes confusion meant that they couldn't vote either. So functionally, they weren't really participating. And if this bill is signed, it will fix that so that people with disabilities, parents, and caregivers can get this accommodation when they need it. Also, thanks to the efforts of Delegate Bennett Parker, Delegate Gary Higgins, Delegate Cole, and others who worked on access to curbside voting, hopefully people with disabilities will now be able to all vote curbside if they need it based upon their disability. Current law only allowed people with physical disabilities and senior citizens to do that, though we know that there are people with a whole range of disabilities for whom planned or unexpected, sometimes navigating a polling precinct is not realistic in person on the day of the election. And this way, those folks can still vote in person if they choose by pulling up to vote curbside. Thanks to Delegate Shen and Senator Aird and others, there's going to be new flexibility for parent caregivers. This was an option that was first allowed under the COVID-19 pandemic to allow parents to be paid caregivers of minor children, those under 18. Those provisions were set to expire. So a lot of the COVID-19 flexibilities, if this bill is signed, will be made permanent. One, that if a parent, for example, a mom, is the paid caregiver under the waiver program, the other parent or legally responsible individual in the house, for example, the father, could continue to be the employer of record, oversee and make sure care was being provided, handle paperwork, those kinds of things. Delegate Shen's bill allows that if a family has 2 or more children under 18 who currently receive waiver, the parent who's the paid caregiver can bill up to 40 hours per week per child who's a waiver user. And the bill from Delegate Shen further allows that a parent not have to prove that they are the absolute last resort caregiver, because they shouldn't be. We know parents are incredible caregivers. We had hoped that this bill would allow respite for parents who are paid caregivers, recognizing for the overwhelming majority of them, they're still only being paid 40 hours a week for working many, many, many more hours than that. And a lot of families have multiple parents in the household. Unfortunately, that provision didn't pass, but it's going to be studied, and a study report is due out later this year for possible action in the 2025 General Assembly. Some other priorities that we were really proud to support that we've seen pass are here. On the access and inclusion side, Delegate Tran put forth a bill for a 2-year pilot project for parks to allow power wheelchairs that they are providing out on trails. So for example, maybe you have a manual wheelchair or a low-key power wheelchair that wouldn't be suitable for using on the parks and trails, that you could borrow one if needed in those settings to make parks more accommodating to people with disabilities and accessible. There's going to be improved prescription drug labeling for people with visual impairments or blindness. July is going to become Disability Pride Month. At this point, paid family leave options have passed the General Assembly, which we know is a huge deal for parents and loved ones of people with disabilities who often have to provide extraordinary care. And the Autism Advisory Council is set to be reestablished. On the education side, thanks to Delegate Cohen, students with disabilities should now be evacuated along with their peers, as opposed to previously allowed plans that said students with disabilities would have to shelter in place in a fire or emergency along with their school staff and wait to be retrieved or rescued by fire and rescue personnel. STARS, our state job coaching agency, is to post more online transition resources, thanks to work from Senator Favola. And there's a study due out in October from Delegate Cohen and Senator Salim on statewide collegiate and university accommodations procedures. So if you're someone with a disability who's going to college for the first time, this study will look at what's it like to request an accommodation, how easy is it, what kind of documentation is being required, and making sure that that's going all as it should. Some other priorities that we worked on were on the criminal justice front. Thanks to efforts from Senator Boysko and Delegate Watts, there's now what's called an affirmative defense to prosecution, which means a way to ensure that charges ultimately get dropped if someone with a disability, developmental disability, dementia, mental health need, etc., is having a crisis, and we call first responders out to help support them in the crisis. And in the result of that crisis, the person with the disability does something like flail, push an officer, right? We're seeing a very clear manifestation of the disability in the throes of that crisis, that should no longer result in a mandatory assault on an officer charge and 6 months in jail. That would be at the discretion of the prosecutor's office and the judge. There's also going to be new minimum in-service trainings for officers on how to communicate with people with developmental disabilities. On the guardianship front, all from Senator Roan, there's lots of positive moves. If someone under a guardianship order would like to petition to remove that guardian, they can now do so by sending a letter to show to the court why their current guardian is unfit and why they think other options should be explored. DARS, our state vocational rehab agency, again, who oversees a lot of guardianship issues, is going to start providing training and a training for guardians by 2025 that will be offered for anyone newly being appointed, as well as people previously appointed. And guardians ad litem, who are the independent eyes and ears of the court overseeing some of that guardianship process, now have the authority to consider capacity issues of the proposed guardian. For example, if the proposed guardian is a private attorney with a caseload of 500 people, do they really have the capacity to know and serve this individual? And prior issues the proposed guardian may have had with adult protective services, any issues or concerns around abuse, neglect, or exploitation. I wanted to thank everyone again for their advocacy and say we'll be in touch as the governor's decisions on signing bills in the budget, amending or vetoing them goes ahead, and we get final news from our General Assembly. But again, we're hoping as much as what we've shared today as possible stays permanent. Thanks again for your advocacy, and we look forward to working with you more.